Hey folks, I'm trying something new today. Some of y'all might have seen a post I made recently about my interest in doing a podcast. Right now, that's not going to happen. I don't have the equipment for it. I'm kind of new. I don't really know what I'm doing, but where there's a will, there's a way. So what I'm doing today, I made a little setup with my cell phone as the camera. I've done my best to make it as level as possible and make sure the lighting was right. So what I'm here today for is to talk about a few things. As you all know, I love to write, and I can write and write and write all day long, and you're gonna see a post 10 miles long. I wanna save you the time. You can watch a 3 to 5 minute video, and I'm just gonna talk about a few things. All right, so this is new to me. I'm probably gonna, stutter. I'm gonna kind of be like, no, wait, I meant this or that. It's gonna take some practice, so bear with me. So what I am doing this for today is to discuss my problem, my disease that I have in my skull. There's a certain, now wait a second, see, here I go. What I have, the disease is called Superior Canal Dehiscent Syndrome, or SCDS for short. It's a rare disease. It's a degenerative bone disease. Something related in that category would be osteoporosis, but they're not the same. I don't know the difference, so you can look those up, osteoporosis and Superior Canal Dehiscent Syndrome. And if you don't feel like typing that out, just put SCDS, Superior Canal Dehiscent Syndrome. There's been a lot of research and they've finally been making some progress into what is causing this. We don't know for sure whether it's a calcium deficiency or vitamin D. That also helps bone health. It could be both. It could be neither. I'll get some answers eventually for you in another follow-up, video like this. So, to recap on what's been going on, these last few months, and then my, surgery that I had a few weeks ago. Over the years, I've been getting symptoms of SCDS. And, it started out kind of with like aches and pains, minor migraines. Sometimes it would be major migraines. What it developed into as this disease progressed was more dehiscence that eroded away the bone at the base of my temporal bone. Without going into details, I don't want to bore you, but in layman's terms, a hole had been formed in the bone behind the eardrum, directly behind and above. The brain started herniating down and started touching the inner parts of my ear. Well, technically it was the middle ear. They call that the bony ossicles. They're really small. You can look that up, the bony ossicles in the ear. I started pressing against them, which was causing hearing problems. Again, I'm not going to talk about the middle ear and all the little different parts like the stapes and the hammer and the anvil and all that stuff. But, it's hard. It's caused hearing problems with me. I'll only say this once, but it's not really the part of the subject, but I had a lot of chronic ear infections growing up all the way through my 20s and 30s, and they seem to have kind of subsided. So the bone had dehisced. It formed a hole. The brain sagged down. That started in around 2018, and it went on for maybe 4 years or so. until somebody finally saw me having a seizure in my sleep. They didn't know what was going on. I was making funny noises, a bit through my tongue. Man, it was scary for them. I didn't have much memory of it, but the doctors finally figured it out. They did some scans. After seeing another number of doctors in the past, they're just like, well, we're not sure what's going on. Maybe you're getting water in your ears from showering. That wasn't the case. There was fluid leaking out of both ears, my left ear and my right ear. So what happened was the holes formed, the brain sagged or herniated or whatever you call it. And then there's a part of the brain, kind of might look like plastic or something. It's just, rubbery, but it surrounds the brain on all sides and holds in all of the brain fluid inside. That has to be intact. You get one little part and it starts leaking out. All that fluid starts leaking out. That happened on both my sides of my head, and eventually it started rupturing my eardrums and leaking through. I first noticed it in 2018. It didn't get diagnosed until 2022. It was scary. I didn't know what was going on. There's this fluid leaking out of my ear. Is it water? Do I have an infection? But it was neither of those. It was cerebrospinal fluid. It's what lubricates your spine, and it keeps your brain lubricated. As you all know, the brain, it's a lot of electricity going on there. Everything needs to be equal in there. You start to leak out fluid, the brain knows that something's going on. It'll automatically overcompensate. It'll make more. But the problem is holes have formed. So when it makes more, it pushes out of the holes, and then it wants to equalize. Sometimes too much comes out, and then there's not enough. Then the brain says, I need more fluid. So what happens is when it leaks out, that creates symptoms of hypotension. I don't know exactly what all that is, but I do know that it kind of makes you feel a little down, a little sluggish. Now, the brain overcompensates. It makes more. And then for days, weeks, as it's draining out again after that, but it's still too much pressure because there's more in there. It's expanding like a balloon. The dura, which surrounds the brain and keeps all the fluid in, starts expanding. The dura breaks open even more. The leaking happens even more. Then you got low pressure in the brain. Then the brain makes more to overcompensate. The dura breaks open a little more. Keeps going up and down. Now, when there's too much pressure, remember what I said about too little pressure, it gets hypotension, you kind of feel sluggish and down. The brain overcompensates and makes way too much, and then it's like a balloon, and then you start experiencing symptoms relative to hypertension. And that can make you anxious, speedy, give you high, what are those called? Migraines. And, it's hard to understand what's going on. It's hard for other people to understand because they're not in your head. They're not feeling the migraines. All they see is, oh my God, I'm in a hurry. Oh my God, I'm freaking out. There's, symptoms of, I don't know, just overexcitement, anxiety, and then when it drops down in the pressure, you start feeling down and sluggish. And it is, the hypotension. So it goes back and forth and back and forth. And this went on for 4 years. I was officially diagnosed with having bipolar disorder because I was showing symptoms of bipolar. Studies have shown that people are often misdiagnosed with having bipolar disorder because of the fluctuations of more pressure and down, hypertension, hypotension. The brain overcompensates to make more, excited, crazy, anxious, then it all drains out too much, and then you're really down all the time. I do definitely have depression. That is a fact. A lot of folks do, and that is to be taken seriously. Depression is nasty. It drains all your energy, your motivation. I always thought of depression as a disease of motivation. For many years, I was very motivated. I was in college. I was in a band. Life was feeling pretty good. And then things started to go downhill, and I didn't know why. I was doing a lot of factory work, and maybe that had something to do with it. There was, a lot of lifting, a lot of walking around on a factory floor. Occasionally you might injure yourself, bump your head on something. This is not to say that the factory had anything to do with it. They're not responsible for a disease in my head. You agree that you're going to do the work, you do the work. You realize that you are unable to do the work, you stop doing the work. I was in a position where I couldn't stop the work. Factory work is common in Ohio, and it pays very well, and I needed the money. It's not what I ever wanted to do, but I did it. So eventually, all of that, I worked at a factory, two factories going on 10 years. I started in 2014, 2015. So, I don't know. Anyways, about 2022, that's when I was diagnosed with Superior Canal Dehiscence Syndrome, SCDS. And they found what's called an encephalocele. It's a tongue twister. ENCEPHALOCELE, encephalocele. And that is, in a nutshell, what I described, where the bone dehisced, a hole had formed, and then the brain sagged into my middle ear, my inner ear, as well as my mastoid process, which is kind of near the back, behind the ear, that whole area. So I had gotten, all of this erosion in, my ear, cavities, and I never knew it. And it might start out very small. There could be a little fissure, a little crack, but you add any pressure and stress and strain and all that in that area, let's say you're coughing. Sorry if that was too loud for you, but every time you cough, every time you sneeze, it puts pressure up there. When you laugh, there's a little bit of pressure. When you cry, there's pressure. It's not to say that y'all need to be careful. That's part of the human experience, is emotions, and that's a good thing. But what happens with someone like me who has this disease? Every time you experience pressure and stress, you're doing pull-ups, push-ups. All of that causes pressure and stress. Someone like me who feels that every time I work out, I'm not motivated to work out because I'm feeling pain and stress. So, as y'all know, exercising is important, but it's hard. See kind of where I'm getting at here? You end up not being motivated and you feel pain, so you don't want to do it anymore. And the lack of exercise leads to all kinds of other problems. It can affect the heart, your lungs. It could affect other parts of your body because the heart and lungs aren't doing really what they should be doing, which is supplying oxygen to the whole body. So it does have other effects. So what was going on? I already explained a lot of it. It was, pressure. The dura had broken. Fluid was leaking out. I didn't know what was going on. I'd seen doctors. None of them could diagnose it. People at the factories are like, well, it's just water from showering. Even, one of my doctors is like, yeah, just wear earplugs. That didn't help. So that's in the past. I'm not going to focus on that too much. But it's common in people with this disease to experience a lot of symptoms like that. Finally, I was able to figure it out. I found the right doctor. He's actually a surgeon. He's the surgeon who saved my life 3 years ago and again a few weeks ago. Um, you know, Not that it would matter. You might want to know who he is. His name is Dr. Saman. So if you ever go see him for any major ear problems, tell him I sent you. He's a good guy. And then the other surgeon is my neurosurgeon. In fact, let me back up a little bit. Dr. Saman is called an ENT surgeon. Now back to my neurosurgeon. Her name is Dr. Hanjani, and she is amazing too. She worked alongside with him and a number of other folks as a team in the operating room to fix me up. As you could imagine, a neurosurgeon is somebody that handles the neurological part of the brain, it's misfiring, there's synapses, there's electricity going on. She's got little probes and things that she's pressing here and there on little parts of my brain to find out if it's still active. She might find what's called a lesion. It is a part of when the brain actually starts kind of like dying. It's not the whole brain, but a little piece of it. It's been exposed to too much trauma. That can cause other problems. You get a little tiny piece of the brain or even bigger, it can be any size and causes a lot of problems. It can lead to seizures. And, people can start developing problems in their head. Let's say if they've got a trauma to the head, they get in a car accident, they hit their head. You can get a concussion. Anything can happen. You can get, other conditions, but I'm not going to worry about that. So, Dr. Hanjani and Dr. Saman, they saved my life twice. I'm totally grateful for them, and I'm grateful for everybody else, everybody who's supported me through all this, the people who believed me. And, I'm not worrying about people that didn't. It's not their fault. You can't really know what's going on. You and I can't really diagnose stuff. So, I kind of forget where I was going. That's my way. I think a lot, and I spin around in circles. So what is happening? I had this surgery 3 weeks ago, and yes, most of the symptoms are gone. I'm not hearing that woo, woo, woo sound in my left side anymore. That is so good. I cannot believe that that's actually gone. I had that for a few years. It just progressively got worse. Why did it get worse? Because the hole was expanding over time. Every time you put pressure, it expands just a little bit. It keeps breaking open. The bone, the base of the skull keeps breaking open just a little more until the brain finally starts sagging in, and then you start getting more nasty symptoms. You let it go too long, the brain will sag even more, the dura will break, more fluid will start coming out, and then you could start having seizures. Anyone who has had seizures or know anyone that's had seizures, it's to be taken very seriously. Maybe another, podcast is, I guess. I'll talk more about, seizures and what to do to help somebody who's having a seizure. I will say right now, first of all, make sure they don't fall. Don't let them fall. You don't have to squeeze them like this. You don't have to shove something in their mouth. Just make sure they don't fall. Now, anything beyond that, ask your doctor, and I'll try to elaborate another time. So, this side was not experiencing seizures yet. It was close, very, very close. The hole was so big that you could see the inner ear, because it had dehisced over the inner ear. It made a hole, and it was so large, now get this, the hole was about a 1/2 inch by a whole inch in diameter. Doesn't seem like much, but when you consider that the inner ear has what's called a bony labyrinth, which contains the canals and the cochlea. Those handle balance, which is the canals, and the cochlea sends the sound information into the brain, as well as a little bit of information from the canals. The brain interprets it. It translates everything, and then it tells you what is up, what is down, left and right. So the cochlea is a very important part, and so are the canals. And that is where the name comes from. Superior Canal Dehiscence Syndrome. Okay. The superior canal is what happens. It handles you're nodding your head this way. If there is a failure of that, if the hole gets so big that it starts to create a hole in the actual canal itself, little fluids in there are not doing their job. There's little crystals inside. They're so small. There's little hairs, what they call cilia. You go like this. There's fluid in there. Now, when you get a cup of water, for example, okay, like this, it's level. Now, let's say you move the cup of water, the water still stays level. You move the cup back up, the water stays level. Why is that? Gravity, okay? Water, fluids, everything wants to stay level. You can lean forward, you can crouch down and pick something up, you can get up quickly. All that's happening with the fluids is it's trying to stay as level as possible. So what happens when a dehiscence happens in the ear? There's a little hole that starts to form in that superior canal because that's the closest to the top of the bony labyrinth, which is right below the temporal bone. And that's where your temporal lobe rests on top of. So it's resting easily. A hole starts to expand and form. The brain breaks down or sags down, and the dura could break. Fluid starts draining out. And meanwhile, the brain is now pressing against the hole that had formed in the inner ear and the middle ear and all that. So what happens with SCDS is it presses against the hole that formed. They call that a third window. I'm not going to talk too much about that, but there's supposed to be only 2 windows, not 3. The third window ends up making things really crazy. That's when you start getting the symptoms that I've talked about before. One is called autophony, AUTOPHONY. Some folks call it autophony. For me, it's easier to call it autophony. It has symptoms that you don't really know what's going on until you can get an explanation. You hear your heart beating. You hear your teeth chewing on food. You hear the grinding of your teeth. You move your eyes. You hear that. You sneeze. It's like blowing out your eardrum when you do that. When you talk loudly, when you yell, it gets much, much louder because you're hearing it inside and not coming in. Now, the problem with that is not only are you hearing your internal sounds, your cracking of your back, my neck always cracks. You hear that loudly in the inner ear because the cochlea hears it because there's a third window. The cochlea takes that information and sends it right into the brain, and the brain hears it loudly. So that was happening to me. But the problem with that is you hear the loud sound inside of your head. It can make you dizzy. It can make you disoriented. Your eyes can start shaking when you hear yourself talking or singing. You hear it loudly and it can hurt. It can cause pain. I've described it to people as like a rumble. Let's say you hear like just something, loud. It's like thunder. and that also happens coming in. That is also part of the autophony. So you've got sound coming in. Let's say you're just speaking to somebody. Your voice is bouncing off the walls and coming right back into your ear. So you've got the information that's hitting your eardrum being sent all the way to the cochlea, and the cochlea sends the information into your brain. It sounds normal, right? You can go to a concert, hopefully you wear earplugs, right? And you hear the sounds and it comes in from here. There is a little sound that's reverberating through you, but since you don't have a third window, you don't really hear it. But when you've got dehiscence, you hear it, and you hear it loud. So that noise is amplified from the outside. And let's say you're a singer, and you're singing, and you've got it loud on the inside. So not only are you hearing your internal sounds loudly, you've also got the sounds of your singing coming in through this one. You're hearing both of them at the same time. So you've got crisp, clear sounds coming in from the outside, and then muffled, loud sounds on the inside. See what I'm saying? I'm a singer. I'm a guitar player. I've spent my whole life in choir. It's something that I love. Well, this kind of makes it really hard to do all that. And, you add that to a lot of other stuff. And if you have depression, it can just feel worse because you lose something that you love. It's hard to do. It causes pain. When you sing, you feel pain, literally. The sounds that come in from the outside, especially for me, not everybody, but high-pitched frequencies make my hearing, and my eyes, they're both affected. My eyes, because my brain kind of perceives balance with sound. Why is that again? Because of the canals and the cochlea. So you get high-pitched ringing like a siren. There's an ambulance coming by. Woo, woo, woo. But it's super loud, and it's like the high-pitched frequency is just cutting right through you. And that makes my eyes start to spasm, and it causes pain. It can lead to headaches, migraines. I can't play music loudly anymore. If I do, it's just, I can get disoriented. I can get cranky because I'm feeling anxiety. Folks, standing next to me might see me kind of getting anxious and I snap. That's a whole different story. But these things can lead to anxiety. These things can lead to frustration where your threshold of reacting to something is very narrow. You reach that point and then it can snap. Some folks handle it in different ways, but back to it. The surgeons, they saved my life. They did what's called encephalocele repair. They repaired the hole. They did it by removing part of the left skull, the left side of my skull. Some of you might see, I don't know if the video is catching up with it too well, but right there at my earlobe, they started cutting there, went all the way behind the ear, and then made kind of like a question mark looking thing. They were able to then, they cut through the muscle, and then they folded the flap over this way to expose my skull. Okay? So then when my skull was exposed, they cut out a little rectangle or a circle, I don't know, enough to remove that part of the skull. And I don't know, what was it, a half inch, a quarter of an inch? I don't know, but they took it out. They took it out. But they had to be so careful that while they're doing that, they don't cut into the dura. Remember what I said about the dura? That is surrounding your brain and holding in all the fluid. Now, let's say in the case of having a surgery, if they cut through that, that's effectively breaking open, and then fluid can start leaking out, and then they've got to repair the dura. And there's ways that they do it. I don't even understand, so I'm not going to try. Um, but they had to remove the bone to get access. How else are they going to get in there? Through the nose? Through my eyes? They've got to. There's the only way that they can do it that I know of is by taking out part of the skull to get access. Once they've got access, they put some kind of surgical tool in at an angle and lift my brain up slightly, enough where it's safe. And that's where the neurologist, neurosurgeon, knows the safe way to do it. She's got probes touching all parts of my brain at all times when it's being lifted, slowly lifted, until the ENT surgeon can actually get in there with his tools. Kind of see what I'm saying? How do they repair the dehiscence and the encephalocele? Well, they've lifted up the brain at least. So the encephalocele, the part, the tissue that had sagged in is now lifted up slightly. What do they do when they cover the dehiscence, the hole that had formed? They take a piece of that bone that they removed, they shave it off where they have a very narrow part of that is still intact. They don't, hopefully it's just one whole piece, much thinner, and they slide that in. They put some kind of glue, maybe screws, some other type of material that scientists have created that creates a seal and a bond. It eventually bonds because it's real bone on top of real bone. And they call that grafting, I think. The body eventually absorbs. If they took somebody else's bone, my immune system would detect a foreign object and it would want to fight it off. But my own bone is easier for the body to say, yeah, okay, let's form together. Think about a plant. You could actually get, another stem or something and attach it to part of the plant. And some of them might actually be able to form. There have been cherry trees that have a little bit of an apple tree because they were able to put it right next to it and it accepted it. It didn't reject it. That's what happens with the bone. You put a little slice, a little shaving of the bone on top of the holes. It creates a seal with whatever sort of material they use. They lower down the brain. They slowly pull out the tool. And then what's left? You still have a hole. You can't leave that open. You've got to put your bone back in, part of the skull. But part of the bone has been removed. So that little section there is a little thinner than the rest. That makes it harder for the, to protect yourself. If you get head trauma, you might hit up top, and you can get damage. But you got this thinner part. It's much less resilient to pressure. You don't want to get punched on the side of your head, especially there, because it can break easier than the rest of the skull can. The skull is the way it is because it needs to protect what's inside. So what happened is they repaired it. They took a shaving, they covered the holes, they lifted the brain. This time they didn't find much of any sort of lesions. There's some that were starting to form. The dura was just about breaking. It was just getting stretched just slightly. You pull on a balloon and there's eventually a point where the balloon will just snap. It was starting to happen. I'm surprised it didn't already because I wasn't leaking fluid out of my ears. Now, they did say that the mastoid process, the back part that I showed you behind my ear, there was also one of those encephaloceles and the dehiscence that had formed over the mastoid process. There, they did find fluid that was leaking inside the bone. The bone is supposed to be aerated. It's strong, it's resilient, but it's also filled with air pockets. What happens when there's fluid leaking? Imagine a sponge, okay? A sponge is much softer than a bone, but they've both got holes that are inside of it, really small holes. Well, the fluid starts filling the sponge, it starts filling the bone, and it can also complicate things. So that had happened. They did find some of that in my mastoid. It didn't start leaking through my middle or inner ear yet, thank goodness. That is when you start experiencing real bad problems, like vertigo and others. So they fixed it. The last video that some of you saw, I'm still continually grateful to all y'all and my surgeons, the whole team and everything. It was immediately a relief because I wasn't hearing from my heart beating. As I mentioned before, you might think like thump, 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 thump. That's not what the heart sounds like, at least with me. It's the rush of water that's going through a blood vessel right next to my cochlea. And the cochlea hears it because there's a third window, and it amplifies the sound of the blood rushing through that blood vessel that's right next to the cochlea, and it sends that information right to the brain, and the brain interprets and translates it as woo, woo, woo. And I heard it all the time. And depending on my posture, I could sit up straight and kind of arch my spine inwards a little bit, and it helps. Now, let's say, I've got bad posture and I'm crouching over all the time. Okay? That ends up causing a change in the pressure that's put on the blood vessels. Okay? So as I'm bending over or sitting back or arching my spine while I'm sitting up or whatever, it changes the pressure that's being put on the blood vessels down there that are sending blood up to my brain, which one of those blood vessels goes right next to the cochlea. And then everything sounds loud. I could crack my back, and even that goes up to my cochlea, cracking my neck, crack, crack, crack. Nobody else hears it, but I hear it so loud, crack, crack. And it's like, it's maddening. So anyways, I don't want to get off topic, but that happens, and it was happening for a very long time. I first started experiencing those symptoms in the mid-teens, I don't know, like 2015, 2016. By 2018, a couple years later, I started leaking fluid. So this is a slow process. It can happen quickly if you've got head trauma. You could end up, getting into an accident, you hit your head, or you fall, you hit your head. That can cause problems. And maybe, just maybe, you could start developing symptoms like an encephalocele or something. Not everybody has that. It's a bone disease. It's a degenerative bone disease. So, you get this. And I kind of lost track of where I was going with this. So bear with me a second. So you've got, this problem with the autophony where it amplifies everything, your back and all that stuff. They repaired it. Immediately after the surgery, I noticed I wasn't hearing woo, woo, woo anymore. I was like, yes, finally it's gone. But I lost my hearing too. That is likely going to be permanent, but it's not a guarantee. The body can heal itself. So we'll see. That's up to me to do anything I can to be as healthy as I can. So I give my body the best nutrients possible to maybe heal that. The brain had sagged through into my middle ear, which is the part of the ear that's right behind my eardrum. That's where it first takes the sound information in before it goes into my inner ear. The brain had sagged over that. That's where part of the hole formed, and the brain was touching my ossicles. And remember I was talking about the ossicles? It's right behind the eardrum, right below that hole that formed that's in my temporal lobe. So it was pressing on the ossicles and was causing major, major problems with my hearing. I remember having a hearing test done, and this was always my bad ear. I was born deaf in that ear because I had a hole in it. Well, all through my adult life, I was having ear infections and stuff and sinus infections. And well, it ended up turning out that while I thought that I was going to have worse hearing in this ear, because the brain started sagging and touching the ossicles, which are the first stop right after the eardrum, it started affecting my hearing. And the results of the hearing test were that this ear had less hearing than this. How could that be? It's because of the disease. So now I'm pointing at my left ear. That's not the problem I was having years ago. It was on this side. So everything I told you, but on the right side. And so you get all this that's going on, and you're trying to work, lifting things. That's what I did. I lifted 50 to 75 pounds a day, 8 hours a day, sometimes 12, sometimes 7 days a week, because I needed the money. And it was a lot of pressure and stress to put on my skull. And it only sped up the process of dehiscence. The fissures, the cracks that started forming in the bone, started widening over time. So from 2016, we'll say, through 2022, that's how long it took. And eventually the brain sagged through, the dura broke. Now this is on my right side. And I started leaking fluids. I started experiencing those symptoms of hypotension and hypertension. I was outwardly aggressive and frustrated, and it was hard for me to understand what was going on. All I knew was I was having a hard time controlling it. And other people, they don't know what's going on. So it's like, there's that guy, and it's hard to hold down a job that way. You could imagine, that it's just hard. And so, you compensate, you try different things, try different jobs. But the point is that your strengths and abilities and what you're able to do and what you like doing, it's affected because of this disease. See what I mean? I'm not able to do music as much anymore. I still can do it. I can play guitar, but I have to wear an earplug, even if it's not plugged in, because it can be very loud. Now, I lost my hearing for now in that ear, my left ear, because of the surgery I just had. My right ear was not as bad as my left ear 3 years ago when I had surgery. So I didn't really hear as many issues in that ear. So, all right, give me a break again. I'm starting to, think about, what I was talking about, where I was getting. So I did just have brain surgery. So where was I? So, you've got all the problems with the dehiscence, the sagging. I was lucky that I wasn't having the seizures. My right side of my brain handles spatial memory, and I believe it kind of handles a little bit of maybe math and music, writing music. All of that is on the right side, and the problem wasn't as bad 3 years ago. But I was alerted of it because I had a seizure and somebody found me having a seizure. You know that I was having seizures longer than that. I just didn't know. I was having them possibly for 4 years. 4 years, possibly having seizures in my sleep. That's when they found out that I was having seizures, was in my sleep. Well, it was 4 years, possibly, that I was having seizures. So in a lot of ways, I'm kind of lucky. I'm unlucky because seizures suck. It's very hard to deal with, and it can cause cognitive problems. And one thing leads to another. I didn't have seizures here on my left side, but the problem was much, much worse because the right side of the brain, for me, not everybody, handles spatial memory, which is your organizational skills, your ability to look around and remember what your surroundings are, slightly affected, which got improved after the surgery. I believe they said that after my memory tests for spatial memory, it scored in the top 86% in the country. So, yay. This side of the brain does not handle spatial memory or math or music for me. It might be different for you. This is your actual memories, and it's your speech, okay? I might sound like I'm speaking eloquently right now. I believe I am, but sometimes I stutter because this kept getting worse. Sometimes I get frustrated because I stutter, and then I could start getting anxiety because I want to form the right words. So something was being affected in there. The door didn't break, the fluid wasn't leaking, as far as I know, but it was definitely having some effect. I know that after, the past like 10 years, I've been recalling flashbacks of my memory, my memories. And it was frustrating, because I would almost relive experiences. Now, don't take my word on it. This could just be me trying to connect the dots. I would actually have to continue talking to neurologists and neuropsychologists and all that to really see if there's a connection between stuttering, getting frustrated, getting anxious, lashing out, all that stuff, that they have actually determined that I do not have bipolar, but all of those could be symptoms. Again, I lost track of what I was talking about, but surgery. So bear with me. I was talking about the memory. So there you go. That's a good example. I get excited. I start thinking about things and I lose track of the moment. So I ended up getting these problems, and they could still be there. I'm not working right now, so I don't have stressors in my life. I'm not door dashing anymore, so I'm not getting road rage. I'm not being frustrated because people are cutting me off and honking their horn at me that hurts my ear. So I'm not going to door dash anymore. I can't. I can't work in factories anymore. It's too hard on me, and I could end up getting really sick. And so the memories, good memories, bad memories. I would remember some things that people would say to me if it would hurt my feelings. I would remember other things that made me feel good. And I would keep reliving those memories in my head. It's not like I would turn into a different person and have a conversation with somebody that's not really happening. But there might be misunderstandings because of how I interpreted things in the past. Me being a visual person, I read lips because I've got hearing loss. I don't read lips very well, but it's there. I can look at the expressions on somebody's face and think that it means one thing because I remember the look on their face or somebody's face from the past. Somebody can do this. They're really mad and they're yelling at me and their eyebrows and all that. They're so mad. Somebody could be smiling and you see that as good. You feel warm. That was how I might have been misinterpreting people because not everybody has the same face. The muscles in everybody's face are different. Raising your eyebrows might mean something to me. I'm very curious about what you're saying. I'm listening, my eyebrows are raising up. And you don't realize it, but that's body language. And you're watching somebody raise their eyebrows, and that tells you that they might be interested in what you're saying. Well, somebody else might raise their eyebrows for a different reason. Somebody might scrunch their eyes, and you might think that they're angry when they're really very nearsighted, and they're trying to do this so they can read. Now, you end up misinterpreting that. Somebody can do this, and because I've got these memory problems that might be tied to the amygdala, which controls your emotions and your fight or flight, you can misinterpret this as somebody being angry at you. Okay? Now this, again, it's not confirmed through anything that I've found, but I've done a little bit of my research, and you put the pieces together and it starts to make sense. And that's when you start asking the right questions to your doctors, your neuropsychologists, your neurologist. The key to finding answers, folks, is finding the right questions. The key to finding the right questions is to be your own best advocate and do your research. And if you can't do your research, maybe you could find somebody close to you that can do it for you, that can help you find the right question so you can ask the doctors for the right answer, and then they can diagnose you, okay? Remember that, okay? I know how frustrating it could be when you don't have the answers and you keep saying the same thing to your doctors and they're like, I don't know. You know, some of them aren't specialists. Not every doctor knows everything. You know, my primary care doctor could not operate on my brain, but the primary care doctor could look into my ear and they could see problems. One of my doctors at the beginning of all of this actually found, they saw through my eardrum, skin, that's what they called it, skin hanging down below my eardrum. Give you one guess what that was. Okay, pause the video, think about it. Okay, now that you've unpaused the video, the skin that was hanging behind my eardrum was my brain. I can't blame my primary care doctor for not knowing that. She's not a specialist. But my ENT surgeon and my neurosurgeon, they were able to piece it together through some CT scans and some MRI scans, and they could actually see the holes that had formed, and they could actually see part of the brain sagging down, herniating, whatever you want to call it, and they determined I was diagnosed with an encephalocele that was caused by SCDS, Superior Canal Dehiscence Syndrome. Okay? That is the order of operations in which it happened. It might be a congenital thing, like genetics. My family does have a lot of ear problems, and it can lead to other things. You know, I was vulnerable to ear infections because, you know, just the way I was born. I was born with a hole in my right eardrum, which made me deaf in that ear until they grafted part of my skin from the mastoid area behind my ear. They took the skin, they stuck it over top of my eardrum, and because it's my skin, my body agreed to it, and everything became one, and I had a whole eardrum again. That is amazing. I can't believe that they can actually do that. There was a day at one time that they couldn't do that, and people always lose their hearing, and it was just, I feel sad for them. But they can now, and they applied that process of grafting to learn how to graft bone on bone. And I forgot to mention, putting the bone back in here, you know, it being thinner and healing and, you know, coming back together because it's my bone. They also put titanium mesh on top of that to give it extra security in case I get more head trauma. Oh boy, I've said a lot. So instead of repeating myself, you know, maybe I could talk more about that. I know I said I wasn't going to, but here I am. What's happening now? What I've discovered, and I'm trying not to panic about this, it's going to end up being something where I'm going to have to get more tests done. My right side, I'm starting to experience those symptoms again. And I'll tell you why I didn't notice it before, and you know, the past few years. While those symptoms were healed through the bone being covered over the holes 3 years ago, it had healed. The nasty part about dehiscence is that it's not done. You can knock it on its back. You can cover the holes. But the problem with a degenerative bone disease is it's unforgiving. It only covered one hole. There could have been a microscopic crack forming next to it. Okay? Well, I haven't had a scan yet on my right side, but they're gonna probably order more scans to see where that is and how bad the problem is now. When I got out of my surgery, I was deaf. I was like, no. And then immediately I was like, well, wait a second, I'm not hearing woo, woo. So I was like, I'll take it. I would rather be deaf than hear that sound ever again. Well, folks, I'm not going to worry you. Don't worry, okay? Don't worry. But I'm starting to experience some symptoms here again with the but it's really, really faint, and it's not all the time. I noticed it first when I was getting out of bed, a week ago. I first really started to notice it. I stretched. Ugh! What happens when you stretch? You put pressure on your body. You put pressure in your head from, and even right now it's starting to make me a little lightheaded because of all the stuff I mentioned before, which I'm not going to repeat. But I hear it quietly. Woo, woo, woo. And then it goes away after the pressure settles, after the pressure is not being pushed up to my head and it settles back into my body. So it's still there. Okay? I'm not having seizures, which is good. I am experiencing a little confusion, which could be my left side. I'm very disorganized now, right side. But you take it as you go. So I guess I'm going to try to wrap this up here pretty soon. The problem in the right ear, I can't get overconfident and be like, I'm cured. That's not how this works. Degenerative bone disease doesn't just stop because you cover up a hole. You could have osteoporosis. Maybe they could find a way to improve the bone density, but it doesn't mean that it's cured. So folks, I don't think that this is over, but I do know that I'm confident that I'm going to make it through this. I'm not going to die, okay? I'm not going to let it happen. I'm not. I'm going to do everything I can. If I have to have 2-3 more surgeries, however many, every time a hole forms, it could take a year, 6 months, 3 years, 5 years for a hole to expand so big to where the brain really starts sagging down and you end up getting seizures and breaks open the dura, fluid starts leaking out, start getting angry and lashing out at people and depressed and getting misdiagnosed with bipolar and all that stuff. It's just a cascading effect, all because of a little crack that started years ago, okay? I think I explained myself pretty well there. So they can't confirm. I don't want to say it's happening. There could be a number of other reasons why I'm hearing that. There are other diseases of the inner ear. So I don't want to try to diagnose myself, but I do want to research so I can ask the right questions. That is key. You always have to ask the right questions and you have to tell them, be truthful about everything. If you drink alcohol, be honest. If you smoke weed, be honest. Okay? Don't be afraid. Their job isn't to judge you. Their job is to heal you, okay? So just be honest as much as you can. Be honest with them, with your doctors. Be honest with yourself, okay? What you do, everything you do on day-to-day life affects your health. Whether you smoke cigarettes, whether you vape. Vaping, they don't even have a full story about how that affects us. I used to vape and it hurt my lungs, okay? Anyways, I'm not going to tell you what to do, but how you eat, how you sleep, how hydrated you stay, how much you have peace of mind is important. Some people meditate, some people pray. Anything you could do to give yourself peace of mind and comfort can reduce stress that can affect you. My stress is right there in my belly. When I'm stressed out, driving around, door dashing, people are flipping me off, cutting me off, I'm flipping them off, all that stuff. Road rage, it starts in my belly, right in my stomach. I tense up and that puts pressure up there, okay? So it's different for everyone. You might not have that. So I guess the main point of this video wasn't to re-educate you, but to let you know that I don't think it's over, okay? This is gonna be for the rest of my life, because degenerative bone diseases are relentless, and they are unforgiving, and they don't care. I have to do everything I can to stay healthy. I have to eat better, and I have been. This last month, I've been having salads and juice, and I've been drinking a lot of water. I'll have carbs, that's fine, but anything I can do to stay healthy. Exercising. My primary care doctor wants me to exercise, but I can't, because that causes pressure and stress. There are certain types of exercise that I can do, like ellipticals, but I couldn't run on a treadmill. Just the fact of the weight of my body hitting one foot, that's 200 pounds every time on each foot. Boom, boom, boom. And it ends up pressure. And not only that, but the sound from the autophony. So, you know, there's a lot of ways that my life has to change. And I've got to find ways, I have to find ways that are going to work for me, okay? I just started seeing a physical therapist, and he is going to have to work with me. I'm going to have to work with him, and we're going to have to take it slow until I find the right way to eventually learn how to exercise and get my heart pumping again and learn how to breathe better. And that might reduce symptoms of other things like stress, anxiety, anger, depression. You know, so ask questions. Ask the right questions. If you don't ask the right question, keep researching. Ask another question. If the doctors aren't concerned or don't understand, ask for a second opinion. And that's what I did. And that is how I saved my life, is I stopped seeing the doctors that didn't understand, and I got a second opinion that saved my life. So I'll end it there, folks. I am so grateful to be alive. I'm glad I was able to make this video. It's long, but imagine if I was to write this on a post on Facebook. It would probably be about 600 paragraphs. Way too much for everybody to handle. But this, however long, I don't know, but I can't see my screen that shows how long it's recording. It's much easier on your eyes and ears. I guess that's what I'm getting at. So I'm going to steal a little line from one of my favorite podcasters named Anton Petrov. He's a science podcaster. And every beginning of his videos, he starts out with, "Hello, wonderful person." I love hearing that. I will just watch his videos just so I could hear that at the beginning. So I'm going to steal that from him, and I hope he's okay with that. So for now, I'm going to just say goodbye, all you wonderful people. Thank you.